Hey, what's going on, guys? Nicholas here, dialysis nurse. Today I'm going to talk to you about CKD. So I have a patient with end-stage renal disease who never really understood what CKD was, so I thought I'd make this video to do a little explaining of it. CKD stands for Chronic Kidney Disease. Chronic kidney disease is basically your kidneys aren't functioning like they should. The kidneys filters out toxins and it filters out excess fluid from the liquids that we drink throughout the day. So when you eat food, your cells take in all that food and it basically poops out toxins. And the same when you drink liquids or eat like melons or something like that, that fluid builds up in your body and comes out as urine. The kidneys help it come out as urine, and the kidneys help take all those toxins. And when you urinate those toxins out. So if you have CKD, chronic kidney disease, your kidneys are no longer doing their job properly. And it all starts with stage 1 of CKD. There are 5 stages. In stage 1, you may not notice the symptoms of CKD. In stage 1, you may notice when you urinate, there's a lot of bubbles in the toilet. So what happens is your kidneys are no longer keeping protein out. You start urinating protein, which is not good. And that protein comes out as little bubbles in your toilet. That's stage 1 of CKD. Usually the symptoms of CKD don't really hit you until stage like maybe 4, definitely stage 5. So risk factors for CKD. Who can get CKD? Uncommon risk factors are people diagnosed with lupus, polycystic kidney disease, an autoimmune disease, pregnant women who have preeclampsia, who end up getting kidney damage from that high blood pressure, and patients with kidney cancer. Now, most people who get kidney disease or kidney failure are patients with high blood pressure that's uncontrolled and diabetics with uncontrolled blood sugar. So if you're not taking care of your diabetes, and you're not taking care of your blood pressure, then you'll end up with CKD all the way up to stage 5, which is kidney failure or end-stage renal disease. So we're going to talk about some symptoms of CKD. So when you actually have stage 4 to 5 of CKD, you'll start experiencing fatigue. You'll get tired really easily. You'll start having trouble sleeping. You'll be up all night. I can't fall asleep for anything in the world. You'll start having muscle cramping. You'll start itching. Your skin is just uncontrollable itching. And you're like, why am I itching this bad? You'll have breathing difficulties. When you're laying down to go to sleep, you will have to have pillows underneath your head because otherwise you just won't be able to breathe. You'll notice swelling in your legs. The excess fluid that's building up is not coming out as urine like it should. It's just building up in your body. With gravity, the first place it goes to is your legs. Eventually, it'll get to your lungs. You'll lose your appetite. You'll usually you eat breakfast, lunch, and dinner. You snack throughout the day. Suddenly, you're not as hungry as you used to be. So those are the symptoms of CKD. Some people with really bad CKD also have this smell that they just excrete from their pores. The toxins that build up in your body, you start to get this stale urine smell that you won't notice because you'll be used to it, but other people will definitely notice it. I've experienced that one time. All right, so I got my little notes here. Other health issues with CKD that you'll experience are high blood pressure. I already mentioned that. If you're not urinating like you should, your kidneys are working hard to produce urine, but it's just not as much as it should. So your fluid is building up in your body. It's also building up in your veins and arteries, causing your blood pressure to go really, really high. You also experience high phosphorus levels. So when you urinate, you usually get rid of excess phosphorus that we eat throughout the day, especially in processed foods. And if you're not urinating that phosphorus out, that leads to elevated phosphorus levels, which leads to elevated calcium levels, which leads to weak, brittle bones, osteoporosis, and eventually this really bad disease called calciphylaxis. Calciphylaxis, really long word. But I have never known a patient to live over a year who was diagnosed with calciphylaxis. And that's basically an excess amount of calcium in your blood vessels that just starts to block the blood vessels, and you start having black spots everywhere, indicating that your skin is starting to die. What else we have here? Anemia. So anemia is basically not enough red blood cells going throughout your body. So I have red blood cells going all throughout my body, and it's carrying oxygen, and it's oxygenating every single tissue and cell all the way to my bald head. Everything is getting oxygen. Your kidneys help produce this. If you have kidney disease, your kidneys aren't producing what's needed to make red blood cells. So, what was that? You'll start getting very tired. So imagine running a marathon and barely breathing while you're running. You don't have enough oxygen to just walk around your house. You'll be very tired all the time, and that's called anemia, and it's due to having kidney disease. It can also be due to having low iron. So I talked about high blood pressure, talked about anemia, talked about fluid overload, talked about high phosphorus and calcium. So hyperkalemia is the last one. High potassium levels. So your potassium would be really, really high. And if you don't know about potassium, that helps regulate your heart rate. So if your potassium is too high, you have abnormal heart rhythms, which can lead to a lot of dangerous things for your heart. So we don't want heart failure. So that's a few things. That's symptoms and health issues that's associated with CKD. Next, I'll talk about the stages of CKD. All right, there are 5 stages: 1, 2, 3, 4, and 5. Stage 1 is when you just notice maybe some bubbles in your urine. Up to stage 5 is when you have all those symptoms that I mentioned to you earlier. You may not notice you're in stage 1 when you're in stage 1. You cannot fix kidney disease. So if you have CKD, you can help it from progressing to stage 5. But once you're in stage 1, you're in stage 1. That's it. You're done. You're not getting that back. Once you're in stage 3, you're in stage 3. You cannot go back to stage 2 or stage 1. So you have CKD stage 3 for the rest of your life unless it keeps going to stage 4 and stage 5. So you can prevent yourself from progressing into these other stages by doing one main thing: listening to your doctors, listening to your dietitians. You will need to start a renal diet. Make sure that you're eating and drinking things that's good for the kidneys. Take your medications as prescribed. Please take your medications as prescribed. If you have CKD because of your high blood pressure, start taking your blood pressure meds. Stop ingesting excess salt. Listen to your doctor. If you have CKD because of your uncontrolled diabetes, start taking serious care of your diabetes. Check your blood sugar 3 times a day. Make sure you're taking your insulin when you need it. When your blood sugar is high, you need insulin to bring it down. When your blood sugar is too low, you need to eat something. You need some energy. You need some fuel to raise that blood sugar to the proper levels. Talk to your PCP or your primary caregiver, your regular family doctor. Talk to your endocrinologist if you don't have one. Talk to your PCP about getting an endocrinologist to make sure you're taking care of that blood sugar. If you have an autoimmune disease, lupus, polycystic kidney disease, you just talk to your doctor. Chances are that you may end up with kidney failure, stage 5. But there are some people who don't make it to stage 5 with autoimmune diseases, lupus, and preeclampsia, etc. So the way to get diagnosed with CKD is it's a 3-month process. So in the first month, they'll take blood work, checking for your creatinine and your GFR. They'll take a urine test. They'll take x-rays or CT scans of your kidneys to make sure there's nothing abnormal going on there. And if for 3 months straight, you're having issues with all these labs, you're having, hey, these labs indicate you're at CKD stage 2. Next month, yep, indicates you're at CKD stage 2. That last month, that 3rd month, if the labs indicate it again, then you're going to be diagnosed with chronic kidney disease. They don't just look at your labs and say, oh, these labs are abnormal, CKD. It's a 3-month process. So if you're diagnosed with CKD, it's due to 3 months of consistent labs and urine tests indicating that you have CKD levels. So I already talked to you about things you can do to prevent it. Another thing that I need to add to that list is smoking. Stop smoking. Take a smoking cessation class if it's hard to just quit. But smoking really does damage your kidneys in the long run. If you drink alcohol, men or males should drink at max 2 a day. And if you're a female, at max 1 a day. But talk to your doctor about this, obviously. Don't just listen to some guy on the internet, even though I'm a nurse. But yeah, you really need to lower that drinking and smoking. I talked about getting on a renal diet. I talked about managing your blood sugar. I talked about taking your meds, especially your meds. Find out what meds you actually are supposed to take. Find out when you're supposed to take them. If you're supposed to take 2 pills twice a day, that means in the morning you take 2 pills, and in the afternoon you take 2 pills, or night you take 2 pills. Not 2 pills twice a day, meaning 2 pills total in a day. So make sure you're taking your meds like you're supposed to. And activity, exercise really helps. So 30 minutes a day is all you need. Walk around the neighborhood for 30 minutes. If you can't walk, do some indoor exercises. Your doctor can hook you up with a physical therapist so you guys can figure out some things to do for exercise. Lastly, we're going to talk about the treatments, things your doctor will do to help you when you get diagnosed with CKD. Medications, obviously, I already told you that. Dialysis. Dialysis is what kidney failure patients get. If you have CKD stage 4, tip it over to stage 5, or if you just have stage 5, you will start dialysis. Dialysis is basically using a machine to act as your kidney to clean your blood and filter out the excess fluid that builds up in your body. The last thing the doctors would do would talk to you about getting a transplant. So getting a kidney transplant is really easy if your family or friend helps donate their kidneys to you. If not, then you'll be put on the list. And when you get a kidney transplant, if you, let's say you have a son or a daughter who's willing to give you their kidney, but they don't match, because you have to match. So if you get a kidney from someone, but you guys don't match, your body will reject that kidney as some foreign object, and it will like try to fight it and kill it. So if you and your son or daughter don't match, your son or daughter can go into the swap program. In the swap program, your son or daughter will donate their kidney to a random person in the system. And because they did that, you will be bumped up to the top of the list to receive a kidney as soon as possible, because your relative donated a kidney to somebody else who really needed it. If your son or daughter, if you don't have someone in your family to help do that for you, to donate a kidney to you or start the swap program, then you'll just be put on the list. And being put on the kidney list is a process. You have to pass all these exams. You have to, you can't be obese. You have to have X amount of health issues in your life. If you're like over the age of 85, then there's like a slimmer chance. But if you're younger, you have a higher chance. That's pretty, and when you do get your kidney transplant, they will not remove your kidney and replace it with another one. You will have a third kidney. So that's kind of cool. If you, like, look it up if you want to see pictures of people with a third kidney. It doesn't stick out of your body or anything, but it's still pretty cool. Lastly, people who are at high risk for getting CKD or chronic kidney disease, African Americans, Hispanics, Native Americans, and Asian Americans. And of course, if you have a family history of it, and high blood pressure and diabetics. So that's all I've got. If you have any questions, shoot me a message. Ciao.